It is. Good evening, Mayor, Commissioners. My name is Danny Walters, and I'm the Division Manager for the Housing Initiatives Division. And just a little background on our division, we do have 3 arms, which includes the federal and state grants, such as the Community Development Block Grant, the Home Partnership Program, and also the Emergency Solutions Grant. We also handle affordable housing, and then our newest area, which is the homeless programs part of our division. And that is what we will be providing an overview for tonight for you. This program was first presented in the budget talks of 2022, and we were able to bring our staff on board in May of this year. And I don't want to take away from the presenters who are most definitely the subject matter experts here. So I just want to take a moment just to introduce the staff, and then I'll turn it over to them for the presentation. So we have 3 members for our homeless programs team. They include Jen Woolsey, who is our homeless programs coordinator, Cicely Thornton, who is our homeless programs project specialist, and then Mitch Young, who we share with the Parks and Rec department, and he has been the city's houseless liaison for a number of years now. So I'll now turn it over to Cicely for the beginning of the presentation, and we thank you for your commitment to the work that we are doing here in this space.
Hello, everyone. Oh. Sorry. It's okay. All right. Take it down so you guys can hear me.
All right. So, I am Cicely. It's nice to meet all of you guys. Good evening, Mayor, Commissioners. My name is Cicely, and our team and I are excited to be presenting this information to you and our community this evening. Our goal is to provide everyone with the information that our team has discovered to be some of the community's biggest needs, focusing around strong, welcoming neighborhoods. So our city's commitment to provide strong and welcoming neighborhoods is defined as all people in Lawrence live in a safe, functional, and aesthetically unique neighborhoods that provide opportunities to lead healthy lifestyles and access safe and affordable housing and essential services to help them thrive. So, to reach the goals of strong and welcoming neighborhoods, the city has identified a list of progress indicators to guide us to success. This evening, our team will be focusing on strong and welcoming neighborhoods indicator number 6, point-in-time count of people experiencing homelessness. Homelessness and housing are very complex topics with many different layers. In recent years, we have observed a community increase of homelessness as well as across our nation. The increase is due to several ongoing factors, including the current COVID-19 pandemic, increases in cost of living, decreases in emergency sheltering options, significant lack of affordable housing, and underfunding for critical needs such as mental and medical health programs for those without adequate insurance. Sorry, I'm so short. Our community's goals should be providing a diverse, equitable housing stock where all community members can access a safe, secure, and permanent home at affordable cost. While working to develop this housing stock, emergency shelters are needed and must be part of the continuum to reach a functional zero. This evening, we will be focusing on two distinct barriers which exist within our community and policies our team is seeking guidance on. The first focus being the inadequate data tool known as the point-in-time count that is currently being used to determine our community's number of individuals experiencing homelessness. Our second will cover the community's lack of adequate, dignified emergency sheltering options. The way we view, interact, and respond to homelessness requires a whole community change. Throughout history, homelessness has been understood more as a monolithic issue instead of a holistic issue. Monolithic would deem the group of unified and without diversity, allowing ideology that the concerns could be alleviated with a single solution. Whereas the holistic approach allows for individualized concerns and highlighting the big picture. The growing amount of research on homelessness response and prevention focuses on complexities around causes, experiences, and impacts of homelessness. To ensure current best practices are utilized, we must be unified as a community and call for a broad, holistic change amongst us all. This will allow for the systems to be changed on all layers. Holistic approaches would continue improving service coordination and the accompanying data infrastructure to help the community understand and respond to homelessness. Communities that have put these ideas into action have done so by coordinated access systems, by names list, data management, and community use of the homeless management system. We refer to it as HMIS. Evidence-supported program models such as harm reduction, housing first, built for zero, and permanent supportive housing programs have also emerged as leading interventions to address chronic homelessness with promising results of success. Part of the reaching success will require communities and governments to better understand and accept these shifts in ideas and systems so we can move away from the crisis response to rights-based homelessness prevention and sustained exits from homelessness. This slide within our current strategic plan presents a 5-year rolling average with a target goal of less than or equal to 250. This goal was developed using the point-in-time count. The point-in-time count is a measurement tool used to identify the number and demographics of individuals experiencing homelessness in any given year throughout Douglas County. Though the annual HUD point-in-time count is still conducted in every community receiving HUD funding, most communities no longer utilize this count as an adequate measurement tool to direct their strategic plans around development and programs and services to decrease and end homelessness. Point-in-time count of unsheltered homelessness are likely a significant underestimate of the actual number. This is because this count provides just a quick blurry snapshot of the issue when what we need to reach zero is a full video of the problem. In 2022, Douglas County's point-in-time count reported 81 unsheltered. Our team can securely state that this number is crucially inaccurate. In the last 3 months, our team has identified and personally met over 148 individuals experiencing unsheltered homelessness in the city of Lawrence alone. We also know there are many we have yet to make contact with. We received this number by personally reaching out, speaking with, and learning the names of our fellow neighbors sleeping on the streets, in the parks, in the woods, in their vehicles, and throughout Lawrence. I would ask when we move through these next slides, we focus less on the messiness of these pictures, but instead recognize that these are the places many of our Lawrence community members call home. Not because they want to, but because they have no other choices. All these individuals have names, stories, hopes, dreams, aspirations, and most importantly, potential. From July 15th to present, our division, along with the Parks and Rec division, have received more than 50, actually 60 I think is our last count, Community complaints around camping. This has resulted in 9 camp cleanups and notices to vacate being issued within the last 30 days. So what is the better solution? Oh, no. Oh, my goodness. I would mess it up. I'm sorry. Why does it keep doing that?
Sorry, y'all, we're having a little technical issues with our video today.
This is mine.
Okay, go ahead and exit out this, escape.
Okay. So I would now like to share the following video from Community Solutions, built for Zero, to better explain why point-in-time counts matter.
We need to share the sound.
Sorry, Porter. Okay, I'm going to finish this. Built for Zero to better explain why point-in-time counts are no longer the best tool. We should be more focused on implementing a by-name list to collect data and develop a holistic system of care.
Where's the video? Here.
Right there.
Sound bottom left.
Okay, but it has to be shared.
You gotta hit share sound bottom left of the previous one. So just go ahead and hit share screen. You almost have it. There you go, bottom left of that window, share sound.
Thank
There go.
you.
Ah. I appreciate your help. Thank you.
Yeah, no problem. All right, let's start it over.
Communities are proving it is possible to solve homelessness.
Working toward a future where homelessness is rare overall and brief when it occurs. They are designing systems that can continuously reduce the number of people experiencing homelessness in a population and make sure that number stays low over time. One of the most important solutions to ending homelessness begins with seeing it. Historically, communities have relied heavily on point-in-time counts, a count conducted on one night every year to understand whether the problem of homelessness is improving. They've used this number to develop strategies and make budget decisions. But the count is just that, an estimate from a moment in time. There are no names behind it, no way to know how that number has changed over time, no way to know what that number is today. Homelessness is a problem that changes every night. To keep up with it, we need a clear video, not a blurry snapshot. Communities are catalyzing progress by shifting to by-name data, a comprehensive profile of every person in a community experiencing homelessness, updated in real time so no one is left behind. All agencies and programs share data in a single place, which includes people in temporary accommodations and people on the streets. Using information collected and shared with their consent, each person has a comprehensive profile that includes their name, homeless history, health, and housing needs. This data is updated monthly at minimum. So how exactly is that helping communities end homelessness? At the individual level, a shared understanding of every person experiencing homelessness in real time changes everything. People move from being a single organization's client to the entire community's client. Leaders can come together around this list, working together to connect people to the support they need. Understanding homelessness in terms of population-level dynamics is critical to knowing how and where to improve systems. How many people became homeless for the first time this month? How many were people returning to homelessness? How many people exited from homelessness? Are the experiences of people moving through the system equitable? Without this information, communities can get stuck in a cycle of solving yesterday's problem without knowing if they're moving closer to their goal. But with this data, communities can implement strategies that are as dynamic as the problem. A commitment to data is more than a commitment to numbers. It's about being accountable to everyone experiencing homelessness and to getting to zero. Communities are proving that solving homelessness starts with seeing the dynamic problem of homelessness at any given moment for all the people impacted by it, and using that information to end it for good.
Thank you. I'm technically challenged, I think.
Why does it just goes away after 14 or after 13? It's so weird. Okay.
Are you sharing this?
Mm-mm. Right here. Then it goes back to the beginning. Oh, perfect. Look, you're awesome. Thank you. As previously mentioned, there needs to be high-functioning, holistic system of care to ensure we have all the components in place to successfully reach a functional zero. These are the components which are currently lacking in our community to reach this goal. As presented in the KU Homeless Needs Assessment, we need every organization who is serving or in contact with our homeless population to have access to and be entering data into our community's HMIS and coordinated entry by name list. This will require an expansion of our homeless management information system and an additional staff member with the Kansas Statewide Homeless Coalition to be hired solely for Douglas County to support this expansion and additional data input. In the meantime, the city and county have combined efforts to develop a GIS mapping system. Our team and other community outreach providers will work together in locating all individuals experiencing unsheltered homelessness. While constructing this system, we will also be collecting demographics on these individuals to then be able to feed it into our support list, which will then be uploaded into HMIS once it becomes fully capable. We need direct street outreach workers whose roles will be working directly on the street and in the encampments to identify, engage, and connect unsheltered individuals to basic needs, vital docs, system intakes, VISPADAT's coordinated entry by name list, and then ultimately permanent housing. So this evening there was a s'more, which is what we call street outreach from us in the county. That should have been on the agenda for this evening. We need additional approved emergency sheltering options for people to access and to end the cycle of continually asking homeless individuals to pack up and relocate. Research has shown this type of displacement does not support the goal of decreasing homelessness, but instead actually causes an increase for the length of time an individual remains homeless. Staff is currently exploring solutions around the needs for family emergency sheltering and additional single adult sheltering options. Okay. Now it is Jen's turn. She is the Housing Initiatives Division Program Coordinator, and I'm gonna let her take over. Thank you, guys.
Thank you.
I'm gonna try to, as y'all can tell, if you haven't noticed, I am somewhat the tall one, or taller one. So, good evening, Mayor and Commissioners. I'm Jen. A lot of people know me as the purple-haired girl. As Cicely discussed, we are kind of in need of some stuff that we have as far as gaps in our community. One thing that we are looking at, some considerations for today. Did that go off?
Yeah, you're not actually sharing your screen.
Oh. Come here, Cicely. Let me try, y'all. I might have to wing it. What do we think? Yes. Okay. So,
Oh, there you go. It is sharing. Okay, sorry. Go-
okay, no problem. Thank you, Al. We spend more time on the streets, I think, here lately, so I apologize. So staff has been actively researching other communities who are having success in operating long-term managed encampment programs for their houseless population. Staff will work to identify potential ways that a managed encampment program could work in Lawrence, and will be returning to the City Commission for direction regarding feasibility of a long-term site, possible locations, and operational recommendations. HID, which is our team, will be requesting support from the City Commission and city leaderships in the latitude to expedite resource, or expedite, I can talk today, resources, and to examine those barriers that exist that make it challenging to move forward with a program such as a managed encampment. And I actually wanted to go here. Another thing that we are trying to look at is also long-term considerations. So considerations of current operations and codes must occur to better provide a balance between those experiencing homelessness, public parks, all open spaces for the benefit, and public parks for everyone to benefit from them, The HID and our partners in the city and the community will undertake a comprehensive review of the various codes and regulations that impact our community members experiencing homelessness, while also understanding that there are multiple community values and expectations in play. Our team is requesting support from the City Commission and city leadership in creating a balanced response using holistic systems management. As Cicely mentioned, homelessness is a complex issue, which will require broad, holistic change amongst us all. To reach functional zero, our community will need to continue working together and providing the wraparound services needed to meet the complexity of all these needs. Thank you for your time, and our team is prepared to answer questions.
Thank you. Are there any questions for commissioners?
Actually, I did have a question, if that's okay. Let's see, it was Cicely? You had mentioned about the HMIS. Yeah, are you working in conjunction with the health department on that? Because I know they've been working on that, a similar system for many years. So are you in collaboration with them on that?
So we are in the process of bringing them in. This is a pretty new program that we are trying to do due to the, so we actually work with the Homeless Management Information System. So I do not believe that the health department is currently collaborating in that system, but they are also doing a similar GIS mapping system. So that's where we will be meeting with them and collaborating to see who they have made contact with, so that we're making sure that those list are combined. What that will ultimately look like, we'll have to see, just because we do have to look at like private information and things like that. But we are working, we will be partnering with them to look at what they've already got.
Thank you. I think that's real important. Thank you.
Yes.
I had a quick question as well. In terms of the encampment, I think I saw it as well earlier, but I just wanted to make sure. Will a lot of the same players involved in, I see Mitch here, in terms of Woody Park, be there to go ahead and assist that as well? Because I know that in doing that, we purchased a lot of equipment that was very useful in terms of the portable showers and things of that sort. And I'm hoping that we can kind of repurpose those for this process as well.
Most definitely. So I will say that without getting too much into the weeds, that we are talking about a temporary kind of campsite area, and then talking about more of the long term. So that what we just discussed was the long term, and definitely we will repurpose. The plan is to repurpose all of those things and follow kind of some of the same systems that were used at Woody. I think that with our new positions, we bring some different experience that will help add to that programming.
Nice to meet both of you.
Thank you.
Seen your name on a few things, but first time we've got to meet. A couple questions. I know the counties, I know with our Build for Zero, we have a by name list we're working on. Are they using HMIS at this time?
They are, and so again, this is a complex issue, and I can get in the weeds, so I have to be concise as possible. So ultimately, our HMIS system is our actual data system that we put the information in. That system is what feeds into the coordinated entry, which ultimately feeds into the by name list. And so why we're having kind of the struggle is just because, as Cicely mentioned, because there is limitations on which providers here in town can access that HMIS. There's a lot of services that are being provided to this population that we're not being able to really calculate, which means we're missing people. So that's why we're looking at doing the GIS mapping at the same time in correlation with it, with hopes that once that HMIS is where we need it to be, we can then feed that information.
Okay, so it's not that we don't have a by names list at the moment, we just don't have a comprehensive one yet.
Absolutely. Okay. That's exactly it.
And out of curiosity, if you know how many are on the by names list now, I know it changes every day or every week, but compared to our, point in time count, and you pointed out the difference, and I know there is one.
So, and I will say that our by name list is needing some updated on some data. The county and our team is working, a lot of partners are actually working, but I do believe we sat about 199. But again, that may have included duplications, and I will securely say that that also included people that have not been added to that list.
Sure. Let's see, I was going to ask you. I have comments, so I'm trying to separate my comments from my questions. As we're working on these, solutions for emergency sheltering, obviously we're going to be working on some long-term. Obviously getting housing first is the goal. How are we working on coming up with these kind of temporary solutions? Are you working with people who are homeless now that you're out there talking with, the providers? What's kind of our process here?
Most definitely. So we're trying to do a combined approach. I will always say that those that are experiencing homelessness have the solutions. They just need us to come alongside them and help support them with those solutions. So we are definitely working directly in the camps. I will say that Cicely and my job in the last several months have been a lot of directly in the camps, because that's where we feel like it's, like I said, that's where the solutions are. In addition to that, we have created a work group, that our team has created a work group through the community that includes as many voices as we can get heard. So we include invitations to housed members, unhoused members, also community, different community, I will say city leadership, also county leadership. We have business owners that have been invited to that group, and then we have advocates. So this is a time where we meet, and we also have law enforcement. So we meet once every 2 weeks, so twice a month, and we all come together around these topics to try to come up with a consensus resolution. Obviously, you can imagine that these conversations can get a little hairy at times, but ultimately the goal is that we all come together because, as we stated, this is a community issue and will require community solutions.
Thank you.
Thank you, Jen. Thank you, Cicely. Just have a quick couple of questions. Thank you for the presentation. In regards to, not to get you too far into the weeds, because that's where I like to live. We'll talk later after this in regards to the HMIS, the by name count, and whatnot. So I don't want to get into like APIs and how are we feeding in and things of that nature, but I would like to have some additional information about that. But in the interest of time, as we transition, as we're trying to get providers and organizations on board to use the HMIS to get that more accurate point in time count, does the HMIS system platform, are you able to look into that system so that individuals who are experiencing homelessness, you're able to track and see where they are receiving services, where they've received services, so that you're then able to see maybe how to diagnose optional, ways to direct them in different ways. So I guess, are you able to see information in there as far as social services served?
Absolutely. And so this is a database that that we really primarily need the human service providers all to be able to have access into. And so they're all set up with different programs, but each individual that is experiencing homelessness is actually entered into the system. They're provided a dashboard. And then as they have contact with different agencies, those agencies actually go into that system. They identify that individual, they pull them up, and then they add them to the services. So why this is so helpful is that as we look at our coordinated entry list, which is all around prioritized housing, and we say, hey, this individual would be a good fit based upon their level of care and their needs and their vulnerabilities to this program right here. Because this is a very transient population, we need to be able to make sure we can find them, right? And so that's where we then can dig into that system and say, this individual was at Catholic Charities 2 days ago. Philip from Catholic Charities, if you see this individual, can you please make sure they're getting connected? Because I will say that unfortunately a lot of our folks that I call them our lived experts, right? Our lived experts do miss out on housing opportunities and different resources because we do lose track of them. So this will also assist us in helping us maintain that contact with them.
Thank you. So high level, you talked about wanting to utilize a holistic systems management approach to this. And you spoke on the consent agenda item in regards to the continual care NOFO. High level, can you explain how that work will marry in and integrate to this? Will it work alongside it? Is this funding opportunity that will dig into this work, or what is it? Because you talked about SMORE, which is part of that piece. So how does that dovetail into some of the HMIS work, some of this holistic management,
Definitely.
holistic systems work?
So the SMORE team, it actually stands for Street Multi-Agency Response and Engagement Team. I don't know if I can repeat that, but anyways, it's called SMORE. And so we identify that we have definitely different individuals who have a work role of being out in the streets. But unfortunately, there's a lot of individuals that are currently unsheltered. And so primarily this SMORE team will be individuals who are directly providing that engagement out in the streets. And an important component of that is they're providing the engagement to basic needs and the care coordination. They're not going to be responsible for the case management. And so what we're seeing with some of the other outreach responses that we do currently have in the community is they do have a responsibility for case management. So, and that can get very extensive when you add, working with individuals with high barriers and high needs. So again, we really want to make sure that this team is out there, and this team are the individuals that when we say, hey, so-and-so is ready for housing or they need this, that individual can immediately identify where they're at so we can go make contact with them.
So the SMORE will serve as kind of that acute triage, and then they will then feed into the more continuous long-term.
Yep. Exactly.
Okay.
Where your FISPADATs happen.
Yeah, where your
Like
housing
initial
assessments.
triage.
Okay, so then will all of these then feed, I know these speak to indicators, and I know in several conversations we've had around work sessions with safe and welcoming communities, safe and welcoming neighborhoods, we've talked about the need for a housing plan and housing strategies, and how the homelessness piece, as expansive as it is, and we're just speaking to one particular subpopulation within the greater population of homelessness, to speak to those strategies of implementation. Do you feel like, are you, in the slide that you have here on 16 about the needs, are these part of strategies to addressing these are your homelessness strategies as it relates to building out these indicators, or
Most definitely. I will say that where we are at, we're in a situation right now because we do have limited shelter. Most of our individuals experiencing homelessness are unsheltered and are out on the streets. So this will definitely be a team that I feel like will be able to make those contacts. And most importantly, as Cicely talked, they would be doing the VI SPDATs, which is the assessment that needs to get them on the coordinated entry list to even get them into the door, or I should say the pathway to housing. So I will say that right now the money that we're looking at is a 3-year program. My hope is, it's a 3-year grant. My hope is that in 3 years we don't need it anymore and we don't have to continue it, and we can look at focusing that money somewhere else. But right now, being out on the streets is where we need to be.
I guess just one more follow-up question. Because I know, so you talked about we have possibly a temporary encampment that's being worked on, followed by the winter shelter, followed by a possible long-term encampment. Can you just kind of talk through what your process is or what you guys are suggesting?
Definitely. So again, as we mentioned, most of our individuals right now that are experiencing homelessness are unsheltered. So they're living in different parts of Lawrence. I will say they're throughout Douglas County, but primarily in Lawrence. So that's what we're focusing on. The idea would be the temporary campsite, that space that will allow for individuals to have a place to go. A lot of times what happens is when we do come in contact with someone and we do have to ask them to leave a certain area, all we're left with is calling the current shelters, and they're doing an amazing job. They really are. But as I know you've heard from them, like they can't fit the whole role. They can't take on all the responsibility of the number that we're seeing. And so then we're left with the question of where do people go? And so the temporary encampment is looking, or campsite I should say, is looking at as a place to say, hey, we've got an opportunity for a place for you to go. And also it prevents some of that displacement that we kind of talked about that does lengthen the time of someone experiencing homelessness. So to allow that area, it's also a place that providers can go, and they're not trying to hunt all over town, because again, where someone may be tonight, they may have been asked to move and they've had to go to a total different location. And if this is a population that doesn't have transportation and doesn't have a phone, which most of the time it is, then they can't even reach out to that provider, and then we lose that motivation and that traction that they've already gained. So again, we're looking at the temporary, and then the idea will be that we will move into the winter shelter December 1st. The winter shelter will be opened for all of December, every night, December, January, February. The plan is to close on March 1st.
12th.
March 12th, excuse me, correction. No, this is how we work, so March 12th. And so again, that idea is that sometimes we have bad weather into March, but at this point we are calculating 75 beds. So as we just previously mentioned, we were at 148. That was when we originally made this presentation. I would probably say that we are now closer to about that 160 number that we've met, because we're actively, again, every day one of us are out on the streets. And so if you look at that, 75 is not going to be enough. So the idea will be that we will, though this area is temporary, we may have to continue to manage and operate it through the winter season as a place for someone to go. And then the idea is that during this time, this team will need to have permission to work on building that long-term solution. And again, we don't use the word permanent, because homelessness should never be permanent and shelters should never be permanent. So again, we're going to start looking into that long term with a hefty goal of March 12th. We'll see if we get there.
Thank you.
Just to pop in addition to Commissioner Finkeldice. So just a tentative deadline for that? You know, I know you guys are also going out and scouting other communities for what their solutions are. When would you bring that information back? Granted, I know this is way down the line, but I'm just kind of.
So I don't have a set timeline. Like I said, I'm looking at that March. I mean, right now, some of that other consideration that we have into play is just some of the other, you know, like governing items that limit us, and so we do definitely have to work through zoning and things like that. So it's really hard to determine a set time frame. I have a lofty goal of, like I said, March 12th, but it will also be very dependent on when we come to you around some other requests with zoning and things like that.
This is Danny Walters. I can say we are working on that in parallel with working on the short term. So our hope would be to get a lot of those pieces together and start going through approval processes and bringing things to you, honestly, as soon as we can start doing that, because March 12th is definitely that date that we're targeting. If I'm not mistaken, I believe that there's some camps that start in the community building on the 13th, which will make it not able to continue the winter shelter in that facility. So we are working on, we have been working on it. So we will have that to you just as soon as we possibly have some longer term solutions to present.
Hi, Dan.